following is sponsored by Medical Media Group and the following physicians and healthcare organizations.
Today, on the American Health Front, there are many women who live with urinary issues, vaginal dryness, or painful intimacy. We discover a non-surgical option that's changing their lives. Breast cancer is one of the most common cancers in women. We learn why it's important to seek treatment from a multidisciplinary team of experts who work together with you. Stay with us as we explore peripheral arterial disease, or PAD, a condition that can cause our arteries to narrow and lead to the loss of a limb. We introduce you to a vascular team whose mission is to save limbs. We also find out how laser cataract surgery can help improve the vision for people with cataracts and macular degeneration. Hello everyone, I'm Marty Caniglio. Welcome to the American Health Front. The purpose of our program is to educate and inform you, the viewer, about treatment options now available in the ever-changing world of medicine. This is a special San Francisco edition of American Health Front. Our staff has teamed up with some of the area's finest physicians and healthcare facilities to explore the fascinating frontiers of today's healthcare, with reports on new techniques and technologies that could change your life. Stay with us, because there's nothing more important than your health. For many women, there can be nothing worse than hearing the words, "You have breast cancer." To better understand the breast cancer journey, we went to Diablo Valley Oncology and spoke with Dr. Tiffany Svahn, a medical oncologist who specializes in treating breast cancer. We learn what the most important thing breast cancer patients can do when they are first diagnosed.
The patient needs to find a team of doctors who will help them treat their disease. Multidisciplinary care is very important in the treatment of breast cancer. Many women will need surgery and radiation therapy, as well as some type of systemic or medical treatment, which may include chemotherapy, hormonal therapy, or targeted treatments. To make it easier for patients, Diablo Valley Oncology developed a multidisciplinary cancer center with a specific breast cancer clinic for patients. Our program includes a cohesive medical team of nurse navigators, breast surgeons, radiation oncologists, medical oncologists, and nutritionists. We all have extensive experience in treating breast cancer, and we work well together, making the patient's journey as streamlined and coordinated as possible.
We learn what other elements Dr. Svahn feels are necessary in providing care for breast cancer patients.
I think it is important to not just treat the person's cancer, but to treat the whole person. At Diablo Valley Oncology, we make sure that all aspects of a person's well-being are addressed. That includes psychosocial support when needed, nutrition, physical therapy, and acupuncture if appropriate. We refer patients to the cancer support community, where they benefit from support groups and other complementary services. In addition, we have developed a survivorship program for our breast cancer patients. When our patients finish treatment, we have a dedicated meeting to address issues that are specific to a woman who has gone through breast cancer treatment. There can be long-term and short-term symptoms or side effects from their breast cancer treatment. We prepare women for these possible symptoms and help to improve them or avoid them if possible.
Dr. Svahn gives us an example of what some of these symptoms may be.
75% of breast cancers are sensitive to the female hormones estrogen and progesterone. Thus, one of the most important aspects of breast cancer treatment involves blocking estrogen production in a woman's body. While this is very successful in improving breast cancer outcomes, it can cause some side effects that affect a woman's quality of life. Since we expect many of these women to live long lives, it is important to maintain the best quality of life that is possible. One of the common side effects of blocking estrogen is decreasing a woman's sex drive and causing vaginal symptoms such as dryness and discomfort. Unfortunately, we cannot always safely use estrogen creams to treat these symptoms because of the potential risk of breast cancer recurrence. Dr. Tim Leach is the first gynecologist in the area to offer a new laser treatment that safely improves these vaginal symptoms. Many of my patients have successfully had this treatment and are so grateful for the improvement that it has made in their quality of life.
Dr. Svahn gives us a few final words of advice for women.
Stay positive and believe in the power of your medical team. We are here to help you survive your cancer so that you can get on with living your life.
Gynecologic health is an important aspect of a woman's overall well-being. Lower estrogen levels in menopause or breast cancer survivors can cause urinary symptoms, internal or external dryness, or painful intimacy, all referred to as GSM, genitourinary syndrome of menopause.
Millions of women report that these changes negatively impact their lives, yet only 25% of them seek help from their doctor. Dr. Tiffany Leach, a board-certified OBGYN and certified menopausal practitioner in Walnut Creek, was the first OBGYN in the East Bay to offer the MonaLisa Touch in 2015. MonaLisa Touch has provided immediate and lasting relief for thousands of women, but is especially life-changing for breast cancer survivors.
MonaLisa Touch is a simple and safe new treatment option for the genitourinary syndrome of menopause with no side effects, no downtime, and lasting results. This painless in-office procedure requires no anesthesia. It takes less than 3 minutes to deliver the laser energy over 3 treatments, which are 6 weeks apart. A small probe is gently placed into the vagina. The laser delivers light energy, which stimulates a healing process, thereby creating new collagen, revascularization with new blood vessels, leading to an overall improved moisture and elasticity, and ultimately allowing a woman to feel like herself again. I have over 18 years in clinical practice and currently serve as the medical director of OBGYN at John Muir Medical Center in Walnut Creek. Being the first OBGYN in the East Bay to offer MonaLisa Touch and having treated nearly 200 women, I have a nuanced experience on how to maximize patient outcomes. This experience has helped me develop new partnerships with local oncologists like Dr. Tiffany Svahn at Diablo Oncology and support groups like the Cancer Support Community in Walnut Creek to help cancer survivors with limited treatment options get this life-changing therapy.
Cancer Support Community helps people with cancer and their loved ones improve their quality of life and find ways to live better and live longer.
I had been married for 2 years, and my husband and I were just unable to be intimate. And then I found Dr. Leach. Dr. Svahn recommended that I explore MonaLisa Touch. He explained to me what was going to happen about first treatment, second treatment, third treatment, and by the second treatment we were intimate, and it was amazing.
Become yourself again and stop suffering in silence. You can now turn back the clock on vaginal